get the energy up? Turn to your neighbor, say, born a champion. Born a champion. Come on. How bad do you want it? Woo-hoo! All right. Give yourselves a round of applause. You may be seated. That was good. Thank you, thank you. Welcome, everyone. Welcome. I'm Dr. Yachter. If we haven't met, I see a lot of guests here tonight. Welcome. I'm so glad that you're here. How many of you guys have been to a workshop before? Raise your hand if you've been to a workshop before. Good. Keep your hands up if you've been to 3 or more workshops. 5 or more workshops? 10 or more workshops? 20 or more workshops? 30? 40? 50? 70? Look, there's 4 hands up. Two don't count. So we'll stop there. Why do people keep coming back to the workshops? Because we have an old saying here. It's when you stop learning, you stop growing. And when you stop growing, you start what? Dying. You start dying. So we want to keep learning and growing. There's something called constant and never-ending improvement. So next month's workshop is Holiday Health and Stress Survival. How many of you guys can believe that the holidays are here? Shake your head and say, I can't believe it. Thanksgiving is next week. Can't believe it. But it really is here. It's unbelievable. So it's the time to enjoy your family and friends, and it's time to give thanks. But it's also a time for a lot of stress. And, you know, statistically speaking, not to be depressive or anything like this, but there's more heart attacks and suicides during the holidays than any other time of the year. There's more stress during the holidays than ever, and it affects our health. Does stress affect your health? Yes or yes? Yes. So how many of you guys want to be healthy through the holidays? Say aye. Aye. So make sure you dial that into your calendar. It's going to be 4 weeks from today. And always remember that if you come to 6 or more workshops, you get 10% off of your chiropractic care, maintenance care. So that means when you're done fixing your spine and you want to maintain it and maintain your highest level of health, it really pays if you continue to learn things to do to take care of yourself, like being at the workshop here tonight. So keep that in mind. And if you don't have one of those little workshop cards, make sure you get one, because it tells you what workshop is every month of the year. And you can see it for the whole year in advance. So tonight we're going to talk about diabetes. Many of you guys heard the promo, or you saw some advertisement about how to reverse diabetes, how to lower your blood sugar, how to lose weight. We're going to talk about all that tonight. What it really comes down to, honestly, is commitment. You know, there's an old saying, when the student is ready, the teacher shows up. Here I am. Okay, so the teacher appears. You guys know that. So when the student is ready, the teacher appears. So not everybody's ready. You know, everybody likes to be entertained. Everybody likes information. But it's not the information, it's the application. It's not the information, it's the what? Application. Information without application is hallucination. How many of you guys want to hallucinate? There's some good drugs you could take for that. I'm not going to get them here, though. So the deal is, you got to take action. You got to take what? Action. So the fact is that it's the fastest growing disease, diabetes, in the United States. There's 70 million people. That probably doesn't surprise you, but the risk of death is doubled if you're diabetic. Your risk of death goes up of many different diseases when you're diabetic, and if you're diabetic, you don't die from the diabetes, you die from the complications of that, usually from the drugs or other diseases as a result of that. 25% of the people are unaware that they have it, which means many people in the room here either have diabetes or you're pre-diabetic and you just don't know it. So that's what studies are showing, that it's a disease that you kind of have to live your life, even if you don't have it, you got to live your life every day like you do have it so that you don't get it and you don't wind up in a crisis. Kids as young as 5 are being treated with prescription diabetes drugs. Did you know that? Because it used to be called adult onset diabetes. It's not. Now they call it type 2 because it's not an onset in adulthood, it's an onset in childhood, because childhood obesity is so out of control now. There's more diabetics diagnosed with kids every year than there is adults. It really is bad. 1 out of 3 kids develop it. So some of the long-term complications, again, it really starts to erode silently long before you feel it. So for example, blindness begins 7 years before the diagnosis of diabetes. It's kind of like cancer. You know, it grows in you, it destroys your health, and then the last thing that they get is the diagnosis when the test finds it. Heart disease, are some of the long-term complications from diabetes. 75% of all diabetics die of what? Heart disease. And what I'm going to share with you is that it's not so much from the heart disease, it's from the medications that they use to treat the diabetes which cause heart disease. So a lot of these are side effects from prescription drugs that we've been led to believe are actually the right approach, and they're not. Strokes, kidney failure, dialysis costing tens of thousands of dollars a month. Your health is your wealth. When you lose it all. Amputations, neuropathy, pregnancy complications, and birth defects. Estimated cost of diabetes lifetime-wise, when you start adding up the medications, doctor's visits, dialysis, co-payments, insurance, premiums. If you're a man or a woman and you're diagnosed with diabetes at age 50, it's usually $172,000, a little bit more, closer to $200,000 now. If you're diagnosed with diabetes at the age of 30, and then you're going to run all those years after that, it's closer to $300,000 or more. And again, you're talking about a substantial amount of money. Now, if you saved that money and you invested it, what would happen? Hello? Yeah. So your health is never a cost. It's always an investment. You're either losing or you're gaining. It's one way or the other. And a lot of people, they don't look at that. They don't look at that. You just, you go through life and you're like, well, I'll just get some good health insurance and I'll pay through the nose for that. But you don't get to use your health insurance until you lose your health. And by the time that happens, it's what? It's too late. Crisis always costs so much more than prevention. And everybody knows that, but again, where's the application? I'm always talking to smart people, I'm always talking to intelligent people, but again, where's the application? For lack of knowledge, the Bible says our people perish. But it's, there's another scripture that says for lack of vision, people perish. What's the vision for your life? Where do you want to be in 10 years? What do you want to be in 20 years? Do you see yourself on a cruise ship? Do you see yourself exercising? Do you see yourself running maybe a Disney or a Boston Marathon? Because all that is possible if you claim that. Or do you see yourself hooked up to kidney dialysis? Or, nobody sees that. Nobody has a vision for their life to be hooked up to kidney dialysis or be financially bankrupt because of this. Or having their kids bail out. Or having their kids cash out their IRAs to take care of your poor health in your senior years. Nobody has a vision for their life, do they? No, they don't want that, but yet that's what's handed to you on a silver platter if you wait for things to break. And by the time that happens, it's what? It's too late. So I want to paint a different vision for you, because you can have whatever future you want as long as you're proactive with that. I love the saying, pray, but tie up your camel. I'll let that sink in for a minute, okay? Don't just go on a wish and a prayer. Have a plan. Have a proactive plan. Don't just hope, wish, and pray that God will spare you from sickness and disease and cure you and heal you, and then drive through your McDonald's and your Wendy's and your Chick-fil-A 2 out of your 3 meals a day. That doesn't work. You're breaking His laws. He created you. God doesn't make junk. If He created you a certain way, you have to honor that. This is 1 Corinthians 6:20 says your body's the temple of the Holy Spirit, not your body. The body that you're sitting in right now is not your body. What right do you have to destroy it, to defile it, to make bad decisions with it? That's bad stewardship. That's poor stewardship. It's no different than mismanaging your money. You go bankrupt financially doing it that way. You go bankrupt physically and spiritually doing it this way. Right or right? It's the same exact thing. So let me go through some of these diabetes medications with you, because this is insanity. And please understand that I know there's a time and a place to take medications, especially in emergency situations, and especially for people who don't know really that there's another alternative and they've wound up in the situation and it's life-threatening. Yes. But once you learn the truth and you understand that there's a different way, then you start looking at these things like it's insanity. Why would anybody do this? And the only reason is because they just don't know that they don't know. But this is typical mainstream healthcare, taking what for your diabetes? Raise your hand if you heard of metformin. Of course. It's on like half of the people that come in my office. It's in their patient history. They're taking metformin. It's contraindicated for people who have cardiovascular problems. If you have a family history of heart problems running in your family, you're not supposed to be taking this. It increases your risk of cardiovascular problems by 2.5 times. So, and no different from either of these. Avandia, Januvia. Oh, these take the prize. So if you guys didn't know that Avandia, how many of you guys have heard of this and the whole scandal of the FDA? The senators blew the whistle on this. That was after 83,000 people had heart attacks. They thought it was the next Vioxx. By the way, Vioxx was a simple painkiller. More people died from Vioxx than in the Vietnam War. And this was right behind it. Because the FDA said it was safe and they passed, the drug company said it was safe, they got the FDA to believe it, and then they did the heart trial studies with all this, and it averaged out to 1 heart attack a day. Over the course of 8 years, 83,000 people. And the long and the short of it is they found that you had a 64% higher risk of cardiovascular death than patients treated with other methods. So you become diabetic, you start taking Avandia, you're 64% more likely to die from a heart attack from taking Avandia than from the disease they gave it to you for in the first place. Does that sound like a good strategy? Of course not. And yeah, so that was from the New England Journal of Medicine. Januvia, that's a prize winner also, 6-fold increased risk of pancreatitis. You have a 3 times greater risk of pancreatic cancer if you're taking this drug. How many of you guys know people taking Januvia? Oh yeah, I take Januvia. Great drug. It's a brand name drug. What do both of these have in common? Brand name drugs. They're marked up thousands of dollars, thousands and thousands of dollars, as opposed to generic drugs that do the same thing, which are equally as dangerous, but the fact that it has a brand name drug makes lots and lots of financial sense. So they make billions and billions of dollars, and people have heart attacks and die, and they get a slap on the wrist, and they maybe pay $2 billion out of the $20 billion that they made. So the drug company, that makes perfect financial sense, doesn't it? You see? But this is the way that things work in mainstream healthcare, where if you don't ask questions and you let your doctor write you a prescription and you go blindly fill it and you don't ask questions, that's how this happens. That's how people become statistics, and that's obviously not what we want for you. Insulin. How many of you guys know people taking insulin? A lot of people take insulin, right? So what does it say? Type 2 diabetics who take insulin die more than twice the rate of those given non-insulin treatment. So is insulin a good strategy to manage diabetes? No. You're actually making the diabetes worse, which you're going to see here. You're actually driving obesity. You're causing weight gain. And in addition to heart disease, in addition to cancer as well, which you're going to learn about all this tonight. So I want you to watch this. This is a medical doctor, an MD. His name is Julian Whitaker. I don't know if you've ever heard of him, but he puts this in perspective as far as what happens when you take insulin.
Hi, I'm Julian Whitaker, MD, with another Whitaker Wellness tip on diabetes type 2. I urge you to forward this to your friends and loved ones who have type 2 diabetes, especially those who are using insulin. Approximately 25% of the 28 million Americans with type 2 diabetes are told to take insulin. If they are obese or overweight, as most are, it's a clear sign that insulin injections are doing more harm than good. Insulin doesn't just escort glucose into the cells. It also signals fat storage and stops fat burning, a recipe for weight gain. Now, excess weight makes blood sugar control more difficult, and poor control increases insulin requirements. In other words, the more weight you gain, the more insulin you need, and the more insulin you take, the more weight you gain.
So, interesting paradox. So again, it begs the question, which is worse, the treatment or the disease? What's the answer? The treatment. So why not correct the cause, the source, and the root? And I'm going to explain that to you. But there have been medical studies also done which show how lifestyle can actually reverse diabetes. So basically, most of these degenerative diseases like diabetes, heart disease, cancer, there was an article done once that said it's quote-unquote diseases for dummies. You know, not that they're calling anybody a dummy, but it's insane to think that 70 to 85% of these diseases are treatable, curable, and reversible with proper what? Proper lifestyle. Yeah. So they did a study. It was published in the Archives of Internal Medicine. 23,000 people, and they asked them to do just a few four simple things: no smoking, exercising 3.5 hours a week, eating a healthy diet, and maintaining a healthy what? Weight. Healthy weight. If your BMI is under 30, that's considered a healthy weight. If your BMI is somewhere between 25 and 30, you're overweight, but you're not obese. Okay, so obesity will definitely cause your body to have trouble regulating sugar. So that's why the BMI is so important. If you don't know what your BMI is, it's a good idea to find out, because that'll tell you where you're at in that range and which way things are going. So the outcome of the study was 93% of diabetics, 81% of all heart attacks, 50% of strokes, 36% of all cancers were what? What do you see right there? 93% of what? 93% of all diabetes is reversible. Now, I've seen it, in our office with our patients with the strategy that we use. Again, when it's applied properly, when there's a commitment, when you draw a line in the sand, inside of 2 weeks. Sometimes immediately. I mean, within a couple of days, we have to have patients call up their doctor and tell them to start bringing down their insulin requirements. And it happens that fast. And you just have to know what you're doing and why you're doing. And you will see results if that's what you want to see. So getting to fitness, just briefly mentioning is, I'm not going to go into a whole exercise bit because it really is simple. If you want to control your blood sugar, if you want to stabilize your blood sugar, you don't have to go join a gym. You don't have to be a bodybuilder. You don't have to lift weights. You don't have to, buy yourself a $3,000 bicycle and go road biking. You don't have to do any of that stuff. All you have to do is get out on the sidewalk and shake your tail feather. Go for a brisk walk. Shake your tail feather. That's what studies show. When you do a brisk walk, 20 to 30 minutes every day, it stabilizes your blood sugar. It increases your metabolism. It kickstarts fat burning. And it really is the most healthy thing that you do to reverse metabolic disease, namely diabetes. And so that's the easiest thing you can do. You pay your taxes, right? I always say that. Don't you own a piece of that sidewalk out there? So use it. Yeah, use it. You can use it. Yeah. So again, it's so simple, but how do we make that work? Who's going to get up tomorrow morning, a half hour before you go to do whatever you normally do and start, briskly walking? Don't raise your hands. Don't raise your hands. But you know what? When you get to that point where you want more to reduce and get off those medications, and you value more your health, your quality of your life, your energy, right? How you feel, how you look over convenience, and over that extra 15 or 20 or 30 minutes of you laying in bed, when you have the discipline to do that, everything changes. And I mean everything. And it's that simple. And now we have stuff that helps us, like an iPhone, right? An alarm clock with a battery backup, so we have no excuses, right? You just dial that in, and you get up 20 minutes, 30 minutes earlier. And then the excuse of being tired, like if I get up a half hour early, I'm going to be tired at the end of the day, that goes out the window, because as soon as you start to oxygenate, you don't get less energy, you get what? More, yes. And you don't need as much sleep. So it's a cycle that you have to break, and then once you take that leap of faith, you have the momentum to continue to make uphill improvements. So that's all I want to say about the exercise. The core 4 strategy that we use, which is function, fitness, nutrition, education, that's our health delivery system. That's all you need to create health inside of your body. A pill, a potion, a lotion, none of that stuff can actually create health inside of you. Health has to be created from the inside out. And I'm going to share that with you tonight. You only need 4 things. And number 1 is to unbrainwash yourself. Unbrainwash yourself. Deprogram yourself from the lies that you've been taught. You've all been lied to. All of us. We've all been lied to. And I'm not saying doctors are bad people. I'm saying the system that we live in is wrong. The system that we live in, our healthcare system, is not a healthcare system. It's a disease care system. That's what we have. We don't have anything that prevents sickness and disease. We have a system that treats it after you let it manifest itself. And then we've got a whole financial system supporting the effects of that. That's not healthcare, guys. Just because you have good health insurance, it doesn't mean that you're going to be healthy. You have to have something preventative. You know what? Insurance doesn't consider much preventative care medically necessary. Right? Medically necessary. What is medically necessary, anyway? That you need Januvia? Right? What is medically necessary? That you need Avandia? Yeah, what is medically necessary? I'll tell you what it is. When you get enough politicians, when you get enough pharmaceutical reps that can bribe the politicians, that's what becomes medically necessary, right? You got it? That's what it is. So unbrainwash yourself, unplug yourself from this, and get the facts, get educated, and take your doctor's advice and recommendations respectfully, and do your research. Do your research, ask questions. Half my family are medical doctors. I'm not saying they're bad people, they're good people. They're part of a system today that's killing more people than it's helping. I hate to tell you that, but it's true. Heart disease is the #1 disease killer. Cancer is the 2nd leading disease killer, 2nd leading cause of death. The 3rd leading cause of death is properly prescribed medication, improperly prescribed medication, and hospital administrative blunders. Kills 250,000 people a year. Okay, so That's something that you need to watch out for. Just like you want to prevent cancer and a heart attack, you want to prevent yourself from being sucked up in that system, chewed up and spit out. Right? So that's what I'm talking about. That's why this is so important. The fitness is important. We just talked about that briefly. We're going to talk about the nutrition also. So, just got my motor running, and now we're going to take a brief intermission. That was too fast. All right, I just want to recognize two people. Two people. I think there's two people. I hope they're here. I hope they're here.
You're on a roll.
Ah! Got my preach on tonight. Patricia Elliott here? She didn't make it, did she? And Johanna. I know Johanna's here. There she is. Okay, so Johanna, can you stand up for me, please? Okay, so everybody, this is Johanna. Why don't you come on up front? Come on up front. Yeah, come on up. Come on up. Make a way for the lady. Okay, so the reason why I'm recognizing Johanna is because she has something called perfect adjustment attendance. How are we gonna recognize Johanna? We have a medal, and they said it broke, so they're going to get you another one. Okay. Why is it a big deal to keep your adjusting schedule, never miss an appointment, and do your home care and do all these things? What are you always going to see? The best results. Yeah, and I love that. I get excited for that. I love to see our patients get results. So I'm really proud of you, and we want to recognize you with our Medal of Honor here for perfect adjustment attendance. Always help, Award of Excellence. All right, thank you guys. So traditionally, historically, at this point, what we do is get you up off your seat, because the mind can only absorb what the seat can endure, and turn to the patient, turn to the person on your right, and put your hands on their shoulders, and squeeze, squeeze, squeeze. Get that blood going, this way nobody's gonna fall asleep. Good. Awesome. All right. Now we're going to do a karate chop. Good. Get all that stress out. Awesome. Good. All right. Turn around and love your other neighbor. Good job. Good. Get all that stress out. All right, so now we're going to do karate chop. Get all that stress out. Love your neighbor. Awesome. All right, give yourselves a round of applause. Heads up, here they come, guys. Here they come. Heads up. All right, all right. Good, good, good. That wasn't too bad. Okay, so what do we need to do? The first strategy is make sure we get our body weight under control. All right? Now, you're either overweight or you're getting older and your hormones are tanking and you're putting it on, and it's harder to keep it off. How many of you know what I'm talking about? Say, I know, the fabulous 40s, here they come, and beyond. All right? Yeah, and beyond. So I'm finding that a difficult reality, but you know, there's always a way to compensate. And I'm going to share some of that with you tonight, because I'm not above the law. I was not blessed with these, you know, thin genes where I could look at pizza and ice cream, you know, eat all that stuff and just, you know, and keep my weight down. That doesn't happen for me. I look at those foods and I put on weight. So if I don't exercise regularly and I don't apply everything that I'm talking to you about tonight, believe me, I go the same direction. So I can show you how to stop that from happening, or I can also show you how to reverse that, pull it into reverse, high reverse. But the thing is, you always have to be conscious of your body weight. You know, how many of you guys weigh yourself every day? Okay, so that's something that, you know, you could or should be looking at, especially if you're going to be proactive. If you're trying to make some changes, trying to see some results, because that'll sneak up on you real quick. If you're not weighing yourself every day, it's easy to put on 10, 15, 20 pounds. Next time you get on the scale, you're like, holy smokes. And you know, all you do is you just go out and buy new pants, and you don't stop and think about it, you know? I have new pants, it feels good, I'm comfortable, but until you get on the scale, you really don't know. But if you're doing it every day, you get off, you go out of range 2 pounds, you can nip it in the bud. I went out of town, my wife and I, this weekend, and you know, whenever I do that, if I don't exercise, if I don't have access to the same foods, That's it. 2-3 pounds goes on usually on the weekend. But I do have a plan. I do have a proactive strategy. So as soon as Monday comes, I know exactly what to do. Actually, I start at Sunday if I can. But I'll show you what that looks like. But we got to control body weight. One of the main things that you probably don't know and you're probably not aware of is that the vast majority of the population of every state in our country is obese. Being overweight inhibits the body's ability to properly what? Control blood sugar. Yes, Dr. Julian Whitaker said that earlier. Nearly 90% of people with type 2 diabetes are overweight. And that's the rapid increase in diabetes due to the obesity of the population. So take, for example, this color right here, the dark rust color orange. That's 35% obesity on average for the state. 30 to 35% of these states are obese. 20 to 25%, these would be okay within normal range. So look at these two colors. 30 to 35% of the population of anywhere that you don't see this is overweight or obese. So that's like literally there's 7 states in the country that's not overweight and obese. So why do you think diabetes is the most rapidly increasing disease in our society? The more overweight you are, the harder it is for your body to manage your blood sugar. And what are the vast majority of these people who have access to health care, Obamacare, whatever we have today, what are they receiving to control their diabetes? Metformin, insulin, Avandia, whatever it is. And as a result of taking those medications day after day, month after month, year after year, what is it increasing their risk of? Heart attacks. What else? Stroke. What else? Pancreatitis. What else? Cancer. See, so they don't die from the diabetes. That's just a metabolic disorder. That's kind of like cancer, When I hear somebody has cancer, I don't look at it as a little mass or a tumor that needs to be cut out. And then once they take it out, whew, I'm a cancer survivor. Thank goodness we got it out. That just happened to my mom. I look at cancer as a condition in your body. And just because you take the mass out, just because you remove the effect, it doesn't mean you've cleaned up the internal terrain. It's the same thing with diabetes. So that's just the condition where, you basically have the insulin receptors in your body tune out to regulating blood sugar. But you can actually re-educate those insulin receptors to tune them back in. And that's exactly what we do. So there is a simple solution, and we use technology, and this is a special program. This is something that requires supervision. You have to have weigh-ins, but there's technology that's available where you put your hand on a scanner. It's called a Zytoscan. And the scan actually reads what your biological preferences are for fat burning, for the fat burning zone. So for your body to burn fat or for it to store fat, this is what the test discerns. So it gives you a perfect and exact fat burning zone as far as a reading goes, and then all these little red dots are biomarkers that fall out of range. The more biomarkers that fall out of range, the more off base you are in terms of fat burning. You're storing fat like crazy here. But then when your hand's on the scanner and it finds these things so far out of range, what it'll do is it scans through supplements and it will digitally test your body to see what type of response you have to those supplements. And the response that your body sends back to the computer will have the effect of either nothing, or it will draw these out-of-range biomarkers back into range. And those supplements will kind of add onto one another until we get most, if not all, those biomarkers back into range. And then we have a customized, blueprinted number of supplements that'll help your body get into fat burning and correct the metabolic disorder. And you watch and see the blood sugar levels go down. Most people are able to reduce their blood sugar, their blood pressure, get off medications. We see it time and time again. And it's not that we're treating those conditions, but what we're doing is we're correcting the metabolic disorder. We're correcting the cause, the source and the root of the condition. And when you get your body healthy on the inside, then it starts to work the way it's supposed to work. And then you don't need the medication. If you keep taking the same medications as when you were sick, when you're healthy, is that good or bad? Bad. Yeah, it makes you worse. All of a sudden you start getting dizzy and this and that. So that's why it's doctor supervised. We have to monitor it, especially if it's a person on medications. So this is technology that makes things very predictable and it's customized. No two patients get the same scan. No two patients get the same supplements. Everybody's program is different. And as a result of that, on average, most people lose about a half a pound to a pound a day. It's a 40-day program. You get a journal, you get a manual, you get weighed in every week. You're on the phone, you get 24/7 access with calls or texts with Allie, and we guarantee your success. Most women lose somewhere between 15 and 20 pounds. Most guys lose somewhere between 30 and 40 pounds, if you can believe that. But just listen to some of them.
Hello, my name is Eileen Gonzalez. Today is my day 18th with the program. Only 18 days and I've been able to lose 15 pounds. Honestly, not hungry at all. Very proud of the achievement so far. I'm not even halfway, and my success so far, I consider it to be a success. It's better than expected. I feel great, I feel energized, I feel that I can sleep less but feel so much rested, and I'm just looking forward to what's coming next.
Hi, my name's Tom Ferguson. Today's date is 2/27/15. To date, I've been on the program about 25 days. I've lost probably about 25 or 26 pounds. I feel great, I enjoy it, I love telling people about it.
You rock. Thank you.
So there's a flyer in your handout, and if it's something that you're interested in, I would ask that you call Allie specifically, use the number that goes right to her cell phone, and if she comes here tonight, then she's usually in this room over here. So at the end of the workshop tonight, if you'd like to see her and make an appointment, what she will do is meet with you and do a body composition analysis. The body composition analysis looks like this. You'll stand on the scale, and it's going to communicate with the computer, and the computer is going to basically list out your body fat, your muscle mass, your visceral fat, how much water you have, how much you weigh, and your metabolic rate, your basal metabolic rate, how slow your metabolism is. You know, you could be 60 years old or 50 years old, but you could have the metabolism of an 80 or a 90-year-old. And unless you correct the metabolism, that weight won't stay off. So this program is not so much a weight loss program as it is a metabolic correction program. And as a result of correcting your metabolism, you lose fat, you maintain muscle, and you let your body heal from the inside out. So it's pretty amazing, but again, it's for people who have a desire to make a commitment. It's like you can see it, you have a vision and say, okay, I'm sick and tired of being sick and tired, show me what to do, hold my hand for 40 days, and we'll guarantee you the results. And if you do that, then you know it's a no-brainer, it'll work for you. So that's normally $99, but that time that you'll spend with Allie where she does the weigh-in and she'll go over the body composition analysis, talk to you about your health, review your goals, and tell you what the plan looks like. It's only $27 if you book the thing with her as a result of the event tonight. All right, so we can talk more after the program tonight. So here's what it comes down to. If you want to control your sugar, if you want to reduce or reverse diabetes, it comes down to this. Type 2 diabetes is developed because we're constantly bombarding the insulin receptors. What are insulin receptors? Well, all day long, you know, we're eating, right? How many of you guys eat most of the day like I do? So we're eating one way or the other. You're, for better or worse, we're eating, right? Now, if you eat, let's say like a paleo diet, let's say like, if you're eating something, if you're eating healthy for the most part, just imagine if you were. Just make believe you do. Play along with me here, guys, okay? So, you know, fruits, vegetables, which also have sugar, right? But with that sugar comes fiber, so it's easily digestible. It slows down the digestive process. You don't have such a fast rush of glucose into your bloodstream, right? Not like soda or candy where it's just, there's no fiber, whew, it just goes right up. So your glucose levels are controlled when you have fibrous fruits, vegetables, you've got nuts, right? You got healthy fats, almonds, nuts, coconuts, avocados, coconut oil, flaxseed oil, you got salmon, right? Almonds, yeah, you got lean meats, grass-fed meats, eggs. So all of this would be a good healthy diet because you're not driving glucose, you're not driving your blood sugar all day long. So it's controlled, and as it's controlled, the level of insulin that your body produces to bring the glucose into the cell is not overwhelming the cell. So all these little hair-like projections are the insulin receptors. So insulin has to take glucose and basically walk it hand in hand into the receptor so that it can enter the cell. Does that make sense? Okay. So you compare that, which is normal function, okay, to the standard American diet, which is what for breakfast? Cereal, oatmeal, bagels, donuts, croissants, you know, so pancakes, waffles, Pop-Tarts, which is all what? Refined carbohydrates, sugar. So you're driving glucose, right? And then you get to lunch. And then what do you have for lunch? You're having a sandwich, you're having a pasta salad. Lord knows, you know, it's like there's always, you have to have those breads to fill you up, right? And then you have dinner. And what do you have for dinner? You have, again, a pasta or a rice or more bread. And what are we doing all day long? And then you have, you know, in between and during the day, because as soon as what goes up has to come down, so after you have a high carbohydrate meal, insulin's going to go up and then it's going to bottom out. And that leaves you high and dry, basically. Then you have no energy at all. So what do you have to have more of? More sugar, yeah. So you have snacks, candies, sodas, and things like that. So all day long, from morning to night, you're driving what? Glucose. And all day long, insulin has to respond to that. So you burn out your pancreas. You're burning out these insulin receptors. So basically, they shut down. You're beating them. You're whipping them to death, so they shut down. And that's what insulin resistance is. And that's why you have high blood sugar, because now you have no more insulin receptors to get the glucose into the cells. So you see where the problem is? So that's why this is, you know, if you give more insulin to a person who's insulin resistant, what is that doing? Is that correcting the cause of the problem? No. Yeah, does any of these medications correct this problem? Of course not. What do you have to do to correct the cause, the source, and the root of the resistance? Is to lay off this. If you lay off this and you go back to normal glucose levels by eating a diet like this, which is low in refined carbohydrates, or eliminating the refined carbohydrates, breads, rice, pasta, cereal. I'm not saying you can't ever have this stuff, but I'll tell you right now, if you commit to a 40-day program and you're serious about reversing diabetes, like literally getting off your meds, I can tell you right now, 9 times out of 10, this happens so fast it'll make your head spin. And now, so the first day or two, that's wow, it's hard, doc. Yeah, okay. So the first day, you get through the first day or two, and that's it. You forget that you even ate that stuff. You don't even think about it. You heard the lady. I'm not even hungry. I don't even think about food. You don't. You just, what you're creating with this is no different than what a person gets with a hit of cocaine, crack cocaine. That's what it is. It's an endorphin release in your brain. Did you know that? When they've done MRIs of people who have done, you know, recreational drugs, whether it be cocaine or sugar, guess what part of the brain lights up? The same part of the brain. Sugar is an addiction, and you can break that addiction. Thank goodness it only takes a couple of days as opposed to a couple of weeks sitting in a rehab center. Right or right? But it's just a transition of understanding what not to do and what to do instead. So again, you know, take this with a grain of salt. Some of you guys are, it's good information. Some of you guys really need to do this. It's a matter of life and death. You just don't know. You have no idea what's going on inside of your body. You have no idea when your last day is. And if you don't start living your life seriously, you're going to be in trouble. And I don't mean to scare you. I'm not speaking that over you. But I'm telling you right now, this is what was meant to go in our body. God made your body. Food by God goes in your body, not food by man. This is all refined. Even the good, healthy grains that we have today. Go over to Publix and you look at the whole wheat bread and all this stuff. They put trans fats in there and corn syrup and hydrogenated fats and all types of stuff in there. Don't be fooled. That's why you have to keep coming back to the workshops. You'll never learn enough to get far away from this fast enough. So this is how you reverse diabetes. Is this making sense to everybody? Yeah. You stop with the breads, pasta, all the refined carbohydrates. Just stop at cold turkey. Now, even if you don't stop at cold turkey, if you make an educated decision when you go to lunch or dinner, and you just tell them to walk away, take the bread basket away, please. You know, I'll just have my fish and vegetables. You know, don't. You know, like if you don't want to sin, don't play in the devil's neighborhood, right? Did you ever hear that before?
Do your insulin receptors, do they come back?
They do, yes. That was a great question. The question was, do your insulin receptors come back to life? And yes, that was the exact point that I wanted you guys to get. Thank you, Babette. they will spring back. Your body can heal, right? If you cut your skin or you break a bone, always, not sometimes, maybe always. Okay, the body doesn't need any help, it just needs no interference. What you're putting in your body has been interfering with your body's normal function. If you remove that interference, it'll go back to doing what it was created to do in the first place. Does that make sense? Yeah, always, always. And so this is what has happened. So how many of you guys remember the food pyramid that they taught you in elementary school, right? Food pyramid. So this is what's to blame, because 60% of that food pyramid at the bottom was what? Sugar. Breads, rice, pasta, cereal, all that stuff that drives glucose. So the year that they recommended the high carb, low fat diet was 1997. So between 97 and 07, diabetes actually doubled. But if you look at the numbers from 81 to 11, over 30 years, it literally quadrupled. So they told us to stop with the fat a long, long time ago. So that's what started this whole rise. But as soon as they went for the high carb, low fat, that was the recipe for disaster for diabetes, heart attacks, and cancer. Because it drives inflammation, and it's just metabolic disease all the way. So that's the transition that we want to make. We want to move further away from this, have less of this, and yes, realistically, if you've achieved your goals, you've lost your weight, you're taking less or no medication right now, you reverse diabetes, do you get to have this stuff ever again? Of course you do. Do I ever have this stuff? Of course I do. Maybe once a week. I don't have it very often. You know why? Because I don't like the way I feel when I have it. I like to be energized. I like to have a good quality life. I like my brain working. If I go to La Bamba on Friday and I have rice and beans, you don't put me in front of a TV and a movie, I'm useless. My brain goes into paralysis. It's just, that's what my body is used to right now. Some of you guys are used to that every day. I don't know, but I'm telling you that if you have this every once in a while, it's not a bad thing, but you're not giving your body a chance to heal unless you abstain from the majority of it now. If you want to see big results now, then you start with this major transition, and then you can go back to having a little bit of it later. But in your handout, I gave you a copy of this here so that you can see the transition from the food pyramid to what we call the House of Health. And you can take it home and look at it later, and you'll see the base of that food pyramid, you should be replacing what's filling you up at every meal. Instead of the breads, pasta, rice, cereal, and all that, should be greens and good fats. Greens and what? Good fats. Good fats are good for your brain. They help control your blood sugar. They help control your blood pressure. They fight cancer. I can't tell you how many health problems could be prevented if 50 to 60% of every meal was good fat. Good fat will not make you fat. Good fat helps you burn fat. But we bought into that old lie that fat is no good, and that's wrong. And I don't care how many articles that you see of these old stuffy medical doctors coming out and say, don't eat coconut oil, it's not good for you. It's just to get you to read their publications, like they're going to get an award or something. They're wrong. They're wrong. Don't believe that junk science. Coconut oil, butter, almonds, avocados, walnuts, olive oil, all these are vitally important and should be part of every meal. Every meal. Every lunch I have an avocado. Every dinner I bathe my vegetables in olive oil. Every morning I have coconut milk. I'm talking about every meal. A piece of that meal needs to be good what? Good fats. Good fats, okay? And not carbs. The good fats will fill you up and it'll energize you. Good fats are like the coals in a barbecue. You ever have a cookout? You ever have a cookout? Where's Dave? Dave's hiding out back there. You know how to smoke it, right? Yeah. So when you use coals, that's the stuff that keeps burning and burning and burning. You can't even blow it out. It just keeps going and going. That's what the good fats are. When I ran the Disney Marathon back in 2003, I did not have pasta and pancakes the night before with the other 23,000 people who ran the race with me. I had salmon and I had water-soaked almonds. And that's what I ran the race on. And I have one problem. I didn't break down. I was back in the office the next day feeling great after running 5 hours, 26 miles, if you can believe that. But that's what good nutrition does. These fats for fuel are good for everything. So make sure that you have it in every meal. So you got your greens, your good fats, and everything else that you need in there. But that's what you should be looking towards implementing more of. And so, obviously, we've talked about all the diabetes creators from all those bad sugars down to the bad oils, right? And we've talked about the blood sugar stabilizers. We talked about all of this. One thing that's good to stabilize your blood sugar also is cinnamon, if you guys haven't heard about that. Cinnamon is really good. You never want to use aspartame or an artificial sweetener. Use stevia or stevia. Use that. The artificial sweeteners will give you diabetes even faster. And I wanted to share this with you, which you'll find very interesting.
We know there's an epidemic of obesity and type 2 diabetes. An interesting article came out in the American Journal of Clinical Nutrition talking about what happens when we consume artificial sweeteners in our diet drinks. It's not news that the American Diabetes Association, American Dietetic Association recommends for people who are overweight or who have type 2 diabetes that they consume artificially sweetened drinks. But what actually happens when we consume an artificially sweetened drink? Does our weight go up? Do we actually lose weight? What happens? Well, it's interesting when we looked at the study that was published in February of 2013 that showed that when you consume 12 ounces a week of diet soda, that the chances of getting type 2 diabetes increased 33%. And if we consume 20 ounces a week, not a day, 20 ounces a week of this artificially sweetened soda that contains aspartame, the risk goes up to 66%. So we're not talking about something that's just minor. A few weeks ago we talked about the fact that there's an association between people who are depressed and people who are consuming artificial sweeteners in their drinks. And it's really interesting how many things that this actually does.
Did you get that? Did you hear that? Okay. So just 12 ounces over a whole week. How many of you guys see people drinking that stuff every day? Every day. Yep, there you go. So what you don't know can kill you. And there's proof. So I don't know if you guys have ever seen this. This was in Time magazine. Menopause. Have you ever heard of menopause? Not menopause. Not menopause, menopause. That's menopause. So this is called disease mongering. So you get to the age where, you know, there's erectile dysfunction or you've lost your ability to perform as a man. And now they're trying to bring that to awareness, and it creates a great advertising campaign because there are drugs that they're using to treat that. So they call it low T. How many of you guys have seen the low T commercials? Right? Okay. How many of you guys ever saw a low T commercial 10 years ago? No, we didn't. How many of you guys saw a low T commercial 20 years ago? No, it's something new. They've realized that, hey, we've got a segment of the market that we can kill right now. Let's call it low T. And so now doctors setting up clinics everywhere, giving testosterone shots, right? And so what's the correlation between your testosterone, men and women, really, because it affects women too, but I'm just bringing this to light, is sugar. They did a study, they found 42 men with normal blood sugar, 23 with pre-diabetic blood sugar levels, 9 full-blown diabetic men. Each man was given a sugary solution to drink and then had their testosterone tested, their blood levels tested. What do you think happened? Regardless of if they had diabetes or not, the testosterone dropped by as much as how much? By 25%. Okay. So, do you think there's a correlation now? Yeah. For every effect, there is a drug, and there is going to be a commercial, and there's going to be marketing. And that's from this to flu season and everything else. So, you know, again, the way I see it, it's like, hey, just sheep to the slaughter. Just waiting to go. All we got to do is clean up the temple of the Holy Spirit. And all this stuff works the way it's supposed to. High blood sugar levels and cancer. Did you know the Journal of the American Medical Association published this study? They found that those with diabetes were roughly what? 30% more likely to develop and die from cancer than those without diabetes. So being overweight increases your risk of diabetes. Having diabetes increases your risk of cancer. And if you're taking medication for diabetes, you're increasing your risk of a heart attack. That's what we call the medical treadmill, the medical merry-go-round. It's insanity, just like I told you from the beginning. And there's one solution. It's all these problems, but it's just one solution. One cause, one correction, one cure. Not all these other things. That's just what makes money. high carb diet equals early Alzheimer's disease. The studies are done now in Alzheimer's journals. They've been published. They know this for a fact, that you're quadrupling your risk of Alzheimer's disease if you're loading up your plate with carbohydrates. You're quadrupling your risk of Alzheimer's disease. What's mild cognitive impairment? It's pre-Alzheimer's. Type 3 diabetes, you will start hearing about. There are many medical doctors that are referring to type 3 diabetes as Alzheimer's disease, okay? Because that's what happens. When these blood sugar levels stay elevated and they mix with proteins, the toxic proteins in your brain build up plaques. And that entanglement that they're finding on MRIs is what's consistent with Alzheimer's disease. Type 3 diabetes, same thing as Alzheimer's disease. Those whose diets were highest in the healthy fat were 42% less likely to get cognitive impairment. That's why those fats are so important, guys. That's your artillery to fight this stuff off. You gotta have good fat in every meal. One of the easy ways that you can keep your blood sugar down from the get-go, this is what I do every morning. I'll roll in the gym, I exercise, immediately after I have to replenish my body with electrolytes, with protein, with carbohydrates, and good fats, right? But I don't want to have a high carbohydrate breakfast. I want to have a breakfast that has low carbohydrates, but really maybe fructose carbohydrates, but some good fat in there also. So this is what I use. Now this is a protein shake, but it's got a multivitamin spectrum in it. 20 grams of protein. It also has a low-level detox in it, phase 2 level liver detox and kidney support. And it's got every multivitamin that you could think of in it as well. So you get to kill a whole bunch of birds with one stone, so to speak. But I mix a couple of scoops in there with my coconut milk. You can mix it with almond milk, and you can make a smoothie out of it if you want. And then I'll have some berries, blueberries, raspberries, blackberries, and I'll have a big scoop of almond butter with it. And that's my breakfast. So I've got my protein, but do I have any refined, heavy carbohydrates? Is there anything in there that's going to allow my glucose levels to go up? No, my glucose levels are stable in the morning when I wake up, and I want them to stay stable all day long, because if I do that, then I stay in fat burning. How many of you guys want to be a fat burner? Raise your other hand if you want to be a full-time fat burner. Yeah, well, you can't start off your day eating donuts and Twinkies and cupcakes and then try to burn fat later. You got to program it from the get-go. From the get-go. That's why I call this the breakfast of champions. Okay, so now my whole family's hooked on it. My kids have it. They have it before they go to sleep. They have chocolate. They have vanilla. We've been doing this for years, guys. There's probably half the people in the room here who are doing it now for breakfast, and I see you coming in with it. And you won't have anything else for breakfast because you don't want to sacrifice how good you feel and how good your energy is for the rest of the day. There's no reason to do anything else once you've experienced that. So that's an option to help you from a nutritional standpoint to help start the day out right. Now, you can have like for lunch today, I didn't want to eat very heavy because I knew I had to keep my energy up for tonight. So I had a green smoothie. I had kale and cucumbers and avocado mixed with that, with the vanilla shake. And that's different. So you can do different things with it. And again, that's something that we can help you with. Yes?
I drink a protein shake in the morning, but I drink it with like 1% milk. Is that like, I know lactose is bad and stuff.
Yeah, I wouldn't recommend milk, and I can talk to you about why later. But yeah, if you're going to use milk, a good source to switch to is almond milk or coconut milk. So you want to get the fat burning in there, and you want to make sure that it's not like, processed and homogenized and grain-fed. So all that stuff we always go into it in the workshops. For this particular workshop, just remember to keep your fats down. I'm going to take one more question, and then if you guys have questions you want to come up after, I'm happy to do that. Yes. Only for Sister Smoot. Yes.
Thank you.
Smoothie.
Is stevia the only artificial smoothie you recommend?
It's the only one that I would recommend. Yeah, I wouldn't recommend anything else. I mean, if you're trying to get your blood sugar down, that's the one that I would go with. Yeah. What's that? It's not artificial. No. So again, if anybody has any other questions, again, I don't want to cut you off, but what I do want to do is I want to finish on time. So if you have any other questions, just come up to me at the end, and I can answer them one-on-one. In your supplement suite, there are 3 particular products and resources that I'm going to recommend, specifically designed to control blood sugar and also to help support a diabetic patient. So whether you're trying to control your blood sugar, reverse diabetes, reduce, get off medications, all 3 of these were formulated to work together synergistically. which means they have an amplified effect when you take all three of these together. And I know because I met with the nutraceutical doctors at Thorne. I was on site there in the facility. And I spent a couple of days studying with them. So a little bit about these, like R-lipoic acid. It supports neurological, liver, and pancreas health. And it's the most bioavailable form of R-lipoic acid, which means bioavailable means you're going to absorb all of it. You're not going to urinate any of it out. Your body can absorb it, and it goes into the capillaries, it goes into your blood, and it goes into the cells where you need it the most. Diagonal is another one. It helps to maintain blood sugar levels, nerve and blood support, blood vessel support, particularly with the eyes and the kidneys, which, again, with diabetes, those are some of the soft tissues that are attacked. And berberine. There's more literature showing berberine as effective as the drug metformin in correcting elevated glucose than any of the supplements. So it promotes healthy respiratory mucous membranes, intestinal flora, which is very important for a strong immune response, and serotonin production as well. So highly recommended with all these. When we give you a supplement suite and we give you 20% off, it's only to incentivize you to, again, make application and use some of the resources to help you if you have this condition or you want to take the next step. We never discount the supplements at any other time other than the workshop. So if you want to get these, we have a limited supply up front there, only a handful of them, but you will receive 20% off if you do that. Another way to save money is to do a Google review for us. How many of you guys have ever read reviews? You could put a review on Facebook, on Google, rate MDs. If you do that, and you give us a 5-star rating, take a picture of it, bring it in, we'll give you a 25% gift certificate. You could use it on any supplement up there. So that's another way that you can do that if you have not done so yet. And so my last question to you is, how do you know if you're healthy or not? How would you know if you're healthy or not? That's a very important question. It's probably the most important question I could ask you. If you leave here tonight and you don't know the answer to this, I have failed. How do you know if you're healthy or not? Usually by how you what? By how you feel. So if you feel good, does that mean that you don't have cancer growing inside of you?
No.
If you feel good, does that guarantee that you're not going to drop dead of a heart attack in 10 minutes? No. So how is it that everybody thinks or believes that if I have no symptoms, if I feel good, that I must be healthy? How is that possible? How is it that everybody thinks that if your mammogram comes back negative, right? You go for your yearly mammogram or your prostate exam, and they can't detect cancer until there's 4 to 10 billion cells in your breast, but your mammogram doesn't detect it that particular year. How are we having the peace of mind to think that we don't have cancer or disease, sickness growing in our body? Because we feel good? Yeah. Is it because we feel good? No. See? Is that true or false? It's false. What is the true definition of health? If you look it up in the dictionary, it says health is the state of complete physical, mental, and social well-being. And what is it? What does the underlined red say there? Not merely the absence of disease or infirmity. Comes from the World Health Organization. Not merely how you're feeling. Okay? I want everybody to feel good. I want to feel good. But I don't want to feel good and die of cancer or a heart attack next year or in a couple of months. I want to know that there's something else going on inside my body right. And then I have objective evidence to know that besides how I feel. So what can we look at objectively to determine whether or not we are creating health in our body or creating disease? Well, the operational definition of health can be seen as a condition or quality of human organism. Who's a human organism? Raise your hand. Who's your organism? Raise your hand. You're all human organisms. We're one big human organism. Expressing the adequate what? Functioning of the organism. What controls functioning in your body? Your brain and your spinal cord. That's what controls functioning in your body. And if that's what controls functioning in your body, what controls health in your body? Same thing. Yeah. If you cut the spinal cord here at the base of your brain, what happens immediately? You're dead. Does your heart function? No. Does your lung function? No. Does your body make new healthy cells? No. So all function and healing originates in the brain and has to communicate down and out through the nerves to every cell, organ, tissue in your body. Your heart does not control function of the body. They can cut your heart out, put it on ice, and put it in somebody else's body. That's not what controls your body. Okay? So if you cut the nerves going to the heart, does your heart function? No. If you cut the nerves going to your eyes, do your eyes function?
No.
If you cut the nerves going to your teeth, what happens?
Fall out.
They rot and fall out. So the nerve system and the nerve supply controls all function and healing to all parts of your body. To your pancreas, that which controls your blood sugar. To your heart, your lungs, your stomach, your spleen, everything. You're making new healthy skin cells right now. You have a new stomach lining in 5 minutes. You have a new heart in 90 days. You have a new skeleton in 9 months. You're sitting there right now and your body is miraculously repairing and regenerating new healthy cells. And you're not even thinking about it. Because you have the amazing intelligence of the wisdom that created the universe inside of you right now. Just like it took you from a sperm and an egg, and it took you from conception to birth, it's doing that right now. It never left you. It's in you. It's creating health inside of you as long as there's no interference. But my question is, were you even aware that you could have interference to that? And if you have interference to your nerve system, what's happening to your function? Increasing or decreasing?
Decrease.
And what's happening to your health? Increasing or decreasing?
Decreasing.
What's the difference between you and a dead person? A dead person has a brain and a spinal cord and all these organs. If somebody just passed away a day or two ago, they're sitting in the morgue, they have a toe tag, but they've got everything that you have, you and I have. What do they not have that you and I have? Life. Life. So if something's interfering with your nerve system, it's interfering with your life. And if something's choking off life to your body, what is it slowly doing to you? Killing you. And if you're not aware, there is a condition that can cause that. It's called subluxation. That's what it does. The bone shifts out of alignment. The bones in your back that were meant to protect the spinal cord of the nerves are now actually interfering with the structures they were designed to protect. Just like your skull protects your brain, those bones are supposed to be protecting the nerves. But if you have slips, falls, trips, car accidents, sports injuries, you're a baby, you get yanked out of the birth canal too violently, everything shifts. And then what it does, it's like a kink in a garden hose, and it's choking off life, whether you feel it or not. Only 6% of these nerves feel pain. What percent? 6%. So most of the time, you have life and health and function being shut down to organs, and you don't know it, you don't feel it. And by the time you do feel it, where do you run off to? Medical doctor, and what do you get? Drugs. Any metformin or Januvia or any of these can lift that bone off the nerve? I don't think so. And I know this to be a fact because there was a lady that walked in my office many years ago, and she was bent over like this. Dr. Yachter, my back's killing me. Help me crack my back. And I said, come here. Let me take a look at you. I got an x-ray on her. And that's what I found in the middle of her back. Bone was wrenched out of alignment. And I'm like, oh my gosh. Lay on the table. I got to fix that. So I put my hands on her and started adjusting her. And she gets up off the table, and she's standing up straight like this. Whoa, I didn't expect that. She stands up, and I see an insulin pump here. So I'm looking down, and I look at her file. She's been diabetic for 40 years. I said, Georgia, you didn't tell me that. She's like, you didn't ask. I said, okay, well, come back tomorrow. Can I come back tomorrow? Let me make sure you're doing okay. She leaves an hour later. Somebody runs in off the street, says, call an ambulance. One of your patients is passed out in her car. I ran out there. There's Georgia slumped over the steering wheel. I came back in. I called the ambulance. I said, oh, get somebody over here quick. And as I hung up the phone, I'm like, wait a second, she's diabetic. I'll bet you have something to do with her blood sugar. So I got some juice, and I came out, and I put it on her lips. And as soon as I did that, she started waking up, coming to. And then the ambulance pulled up, took her away. And I'm walking back to my office as I'm watching the siren and the lights flashing, and I'm thinking to myself, wow, that's not good for advertising. And I walked back in, and I'm saying to myself, that's not good. I'll be lucky if I don't hear from her attorney. So I thought I did something very, very wrong at that point. I didn't sleep very much. I came back in the office the next day, and make a long story short, she walks in. I'm taking care of people, and she walks in. And I'm scared. I'm thinking that I better duck or run because this is not going to go down well. But she's walking up to me, and before I know it, she puts her arms around me and gives me a hug. She says, Dr. Yachter, I don't know what you did yesterday, but I haven't slept this good and felt this good in 40 years. Can I have another adjustment? And I'm like, yeah, I'll give you another adjustment. It's good to see you. I need to show you something. Come on over here. And I took her over to the x-ray. I said, I think I found something. Georgia, I think I moved this bone out of alignment here. I got the pressure off the nerve, but that was the same area that was going off to your pancreas. And when I opened up the nerve channel going to your pancreas, I think your pancreas started functioning and making insulin. But your pump was still on, so she got too much. Yeah. And I said, that's why you went out there and passed out. I think you got too much. She said, well, that's an interesting theory. Are you going to adjust me now? I said, yeah, better than that. And as the weeks went on, she come up to me, she said, oh, by the way, my endocrinologist just reduced my insulin requirements. Another week went by, oh, by the way, my endocrinologist at University of Miami just reduced my insulin requirements a little bit more. And then another 2 weeks went by, she said, Dr. Yachter, I'm eligible for a special study at the University of Miami. My endocrinologist never seen 67-year-old brittle diabetic go from 8 units to 0.8 units in this shorter period of time. He wants to know what your clinical protocol is. I said, tell him I move the bone and God does the healing. Yeah. So the point is this. So the point is this. If I would have given her R-lipoic acid, berberine, or any of that stuff, would it have lifted the bone off the nerve to release life to her pancreas? No. If you take those supplements and you put them in a dead person, what happens? Nothing. Now you guys aren't dead, so it may help you. Yeah. But I'll tell you this. If you're subluxated and you walk out of here and you've got this going on and you take supplements, you're wasting your time and you're wasting your money. I'm not here to sell you supplements. I'm here to sell you on you. That you were created by the most amazing power in the living universe. And that power left a piece of himself inside of you. It's called innate intelligence. And that's what uses your nervous system to express life. You live your life through your nervous system. What you see, smell, taste, touch. That's what allows you to adapt to your environment. That's the operational definition of what? Function. So how important is your nervous system, guys? Yeah, you can eat good and exercise, but it's all for naught if you don't know for a fact that your nervous system is clear. If you don't have neurological clarity in your body, you're gambling, you're guessing, and you don't have to do that. I mean, if you have a chiropractor and you see them regularly to make sure they check you and clear you out, whether you feel that or not, then you have a proactive plan to prevent sickness and disease and stay out of doctors' offices, off medication, out of hospitals. I know this for a fact. Studies have been done. They show that people who are under regular chiropractic care, 5 years or more, their immune systems are 300% stronger. If your immune system's 300% stronger, what does that do to your risk of cancer? Yeah, it also shows that people who do this, who are under regular chiropractic care, they take 83% less pharmaceuticals, less medication, 60% less hospital visits. So again, I think if you had access to something that could give you those results, how long would you do that for? Forever. Why would you not at least take an opportunity to look at your spine and see if there's anything stopping you from having that? And so that's what I'm asking you guys. I mean, you come in here, you learn, make the application. But if you turn around and walk out and you're not having your spine checked by a qualified chiropractor on a regular basis, you're missing the most important part of your proactive preventative health care. And I can tell you this after doing this for 25 years. I said this last seminar. You stick me on a desert island, you give me all the supplements in the world, a good place to work out, or an adjustment. If I had my pick of only one, I could tell you hands down, it would be to get adjusted. Why? Because neurological clarity allows you to adapt to any other abnormal conditions at your highest level. That's what gives you the advantage to health and life. And that's what time has shown for over 120 years. And that's the thing that I get adjusted about. I get excited about adjustments. How many of you guys, when my hands leave you, right? I can look at every single one of you, and you know, when I move that bone, I jump. What do I say? Woo! Awesome! Yeah! Because I'm turning on life. Because I'm working with the power that animates the living universe. God's my partner. How could something not good happen after we release more of that in your body? I just don't understand that. I'm the eternal optimist. When I say I move the bone and God does the healing, I know that every time I adjust you and you get off that table, you are well. Rise, walk, and heal. You will be better. No ifs, ands, or buts. You can't tell me otherwise. I know what I'm working with. God's my co-pilot. God's who I'm working with. I'm working with His power. How could something not get better after you release more of that in your body? Right or right? Yes? So, okay, so here's where we make application. You need to know that every nerve that exits your spine goes to a particular part of your body. And if you've got any of these symptoms, whether it's diabetes or constipation, bladder problems, frequent urination, prostate problems, liver problems, breathing problems, headaches, dizziness, there is a part of the spine that you can look at to see if that's where the cause and the source and the root is coming from. But even if you don't have any symptoms, is it a good idea to have it checked every once in a while? Yeah, because it's an insidious condition. And really the only way to reveal where it's coming from is to look at a scan. Sometimes we take x-rays, but you got to look at a scan because that will show us, it'll allow us to zero in where some of the problems are. That's a normal scan. Close and tight to the midline, nothing really erratic. Somebody comes in, they have something like this, and they got frequent urination or painful irregular periods, they can't get pregnant, constipation. That's the area where the nerves are messed up, because those are the symptoms that we usually see. That's a person who could have thyroid problems, fatigue, tiredness, insomnia, dizziness, headaches, depression. You know, if you have symptoms, you can treat it with drugs. But there isn't a drug on the planet that can actually restore normal nerve supply and healing to the body. And that's what we do. So these are the tests that we utilize, and when we look at that, that gives us a good objective, evidence-based picture. I also do neurological testing, range of motion. We do a very detailed patient history, a family history. We sit down with you, we take a lot of time with you, because we take our results very seriously, and that's your health. This is our life work. This is my life work. This is my mission. You are my mission. And I don't take that lightly. And so if your health is important to you, and you've never had somebody look at it this in depth, then I'm going to invite you. If you're not a patient here, I'm going to invite you to make an appointment tonight. Normally, the services that we're talking about on that first visit for the evaluation, the examination, is upwards of $200. But if you'd like to make an appointment tonight, we do that for only $40. And that's my gift to you. And that gift isn't around forever. It leaves when I leave the building. So I can tell you, if you're serious about your health, seriously, you do it. I'm not here to waste time. I'm not trying to make a patient out of you. I don't want to twist your arm. I don't want you to waste your time. Like, if you're not serious, then don't make the appointment. I love you just the same. Come back next month. We'll learn more. We'll keep growing together. But if you are serious, you want things to change now, and you want this right now to start being your healthiest year ever, before the new year, then walk over there to Deborah, make the appointment. Okay? Walk over there and make the appointment tonight, so she could sign you up, so we could sit down and look at things and start your life transformation. Okay, so by the way, you're able to make that appointment even if you have a loved one that's not here, spouse, kids. You can purchase one of the vouchers for them as well. So I'm happy to do that for you. Allie's there. Raise your hand, Allie. Everybody, turn around and raise your hand. Say hello to Allie. Allie, where are you going to be? By room 3. She's going to be room 3 if you want to see her and talk to her more about the program, the other program, the weight loss program, and the metabolic program. You can talk to her. And by the way, the $40 for the examination, if you are making an appointment tonight, all that 100% of that goes to our mission to Haiti. This is something that we've been supporting since 2000, since the earthquake knocked out the walls in the building for the church and the school. And with the funds over many years now from doing this, we've helped to rebuild the church, the classroom, many buildings, bathrooms. We also feed and clothe and pay for the education for the kids. I can tell you, I made a commitment for $5,000 this year. We're $1,200 short, and so we got now until the end of the year. So I'm just helping you. I'm telling you guys that if you want to be a blessing, it's win-win-win. And so this is heavy on my heart. I love being part of that, and I love when you guys are a part of that. So I appreciate you for participating in that. So make sure you get credit for tonight's workshop. Make sure you make your appointment for your chiropractic evaluation, your nerve system evaluation. Talk to Allie. Get the supplements. If you want to get supplements, like I said, there's limited amounts there. And I look forward to seeing you next month. Love and appreciate you guys. God bless.